will pay a heavy price for violating these curfew orders. There is now plenty of research to show that countries that don't lock down quickly enough will suffer. And an individual who has a very strong view on this is Tomas Pueyo, who joins us this evening. 40 million people have read his articles. He has been advocating stringent quarantine measures, lockdowns, suppression as he calls it. Good evening, Tomas. Nice to speak to you. Tell us why it's so important,
Likewise,
specifically in a country like us, like India, to observe quarantine and lockdown procedures.
it's all about the exponential growth. We have, India right now has around 300, 400 cases, but Turkey used to have that just 2 days ago, and now they have more than 1,000. Then whenever I talk with a country, I hear, oh, we only have a few hundred cases, it's not a big deal. And then 3-4 days later, they have thousands. And then 2-3 days later, they have tens of thousands. This has happened in Italy. It has happened in the US, in Spain, in France. And that's even more true in countries that don't have too much testing, like I believe India today. So it might very well be that India doesn't have hundreds of cases, or thousands of cases, or tens of thousands. And that then grows exponentially. When that's the case, it's very, very, very hard to control. And every day that passes, this grows more and more and more and more and more. So the only way to really stop this is to be very, very serious and to reduce the amount of people that we meet.
Right.
Otherwise, every time we meet people, there's a likelihood of contagion. If we do that, this will buy us time, which is the most important thing that we have today. We need today. Otherwise, we need this time to test better, to be more prepared, to prepare our healthcare system, to understand how this virus works and how to control it. Until we understand this is running amok everywhere, and we need to control it. And the only way to control it, when we're not very, very clear on where this virus is to do social distancing. And that's why respecting the lockdown is so important.
Now, you've done a lot of study, mathematical models, etc. What really struck me as a bit alarming was your projection on China. China was reporting X number of cases, but the actual cases in the population were exponentially more. Now, India has only reported about 430 odd cases at last count. Do you believe that there are many more people out there actually today, actual numbers?
Absolutely, and you see that in every country that tried to. Yes, I can hear you.
I can hear you. Go ahead. So you're saying
yes,
that there are exponentially.
So you can see that in every country that has done this, like Italy, for example. As soon as they started doing testing, the number of cases exploded. But I'm not sure I responded to your question, but I had a hard time hearing. Can you repeat that?
I just said, is it a possibility that there are many more undetected cases, and when will they come to the fore?
Yes. So one way that we can assess this is with a quick rule of thumb around the deaths. Right now, there's 8 deaths in India. And usually early on, you can use a multiplier. You can multiply that by 800 to understand the number of true cases, right? And if that was the case, in India, you would have 6,000 cases and instead of the 400 that we have. And the other way that we can look at it is every other country that was in a similar situation. They were doing very little testing, and they were saying, you know what, there's very few cases here, we're okay. But then suddenly the deaths start piling up, and they realize, oh wow, the problem is bigger than we thought. And then they start testing more, and suddenly there's an explosion in cases. It's not like the cases were growing much faster; it's that the testing was going faster. And I'm not seeing enough testing in India today to understand really the true situation.
Okay, so Tomas, let me ask you this, because India locked down very early. We had barely 100 cases and we decided to lock down. No international flights were allowed. Now, in fact, no domestic flights are allowed. There are restrictions in more than 90 districts of the country. At last count, many states have imposed total curfew where not more than 3 people can obviously venture out. Would that not have advantaged us at some level over China and Italy and Spain and France?
Absolutely. This is such a huge deal. I cannot imagine how many tens of thousands or hundreds or even millions of people are going to leave thanks to that. So it's great that we've done this.
Yes.
Unfortunately, we're still blind because we're not testing enough, right? So we still don't know the level of the cases. And it's also true that it's very good to focus on the communities that are hardest hit, but also this needs to be a policy at the national level, because otherwise, what if some states are doing a great work and some others are not? The regions that are not controlling this properly might be having an outbreak and exporting these infections to the states that are doing a good job. So I think this is great. The other thing that's important is also the details here, right?
Yes.
Because how a curfew is actually done matters a lot. If it's a lockdown with a curfew that is respected by everybody, that is fantastic. But if people don't respect it, like has happened in Italy, for example, then the cases might still grow for a few precious days. So we need to have measures like this. This has already saved a lot of people. We need to continue doing it, especially until we have a clear sense of the total number of cases. And we will only do that if we test. So I think the World Health Organization has a recommendation, which is test. And I think that's the most important one.
Okay. United Kingdom followed the herd immunity model. They said, let as many people get infected, it's going to die out, no problems. How do you react to that?
I think we need to understand a bit better how they think about it, because said like that, it is complete nonsense. I think what they're trying to say is it's based on an analysis that came a week ago. And what the analysis said was, you can either have an outbreak now, or you can close the economy for months, and you would still have an outbreak a few months later. So if you're a politician, and you're hearing that,
yes.
So if you're hearing that as a politician, you will decide, okay, let's have the outbreak right now, because otherwise it makes no sense. I'm hitting the economy. So I think that's what happened in the United Kingdom.
Right.
The problem with that is that it doesn't account for many things. The most important is time. With time, we learn. With time, we can have treatments. With time, we can have a better healthcare system. With time, we can reduce the number of cases. With time, we can have better testing, right? And so if we lock down now, we buy ourselves time to do all of that.
Well,
it's also true that these analyses supposed lockdowns for months, but we already know that's not true, because both South Korea and China were able to reduce the cases within weeks.
yes.
And so what I would say is the United Kingdom's policy is crazy.
Okay.
And it's going to cost hundreds of thousands of lives if they continue. Now, little by little, they've been reducing they've been increasing their measures.
Right.
But it's not fast enough.
They
should have done it weeks ago and fast.
It's not fast enough. Tomas Pueyo, thank you very much for speaking to our viewers in India through Times Now. Thank you very much for joining us. Remember what he told you, that some politicians were not wanting to take the hard decisions. Well, the Prime Minister of this country has done. The Chief Ministers of 28 states are doing that. And once again, I'm telling you, viewers, it's up to you. It's up to you to make this all succeed in a way that we're all safe and we come out of this relatively unscathed. We've already seen that number jump from just about 100 cases last Sunday to more than 430 cases as we speak right now. How many more lives do you want to risk, viewers, to corona before you learn to stay at home? Now, there are concerns. It is necessary to break the chain. We all agree for defeating the coronavirus. For ensuring this, the Modi government has called upon states to enforce the lockdown. There are restrictions on the movement of people to stop the spread of the virus. But viewers, it has badly impacted various sectors of the economy that are in dire need of a lifeline now, especially those who earn their wage on a day-to-day basis and constitute much of our unorganized sector. They are looking for some relief. How do you expect these people to stay at home if they're going to starve? Their work is their lifeline. So are we going to, in some measure or the other, benefit them to incentivize that they stay at home, supplement their incomes? That's really where we need to be focusing. Now, viewers, the challenge, the numbers are mind-boggling in a country like ours. I put some numbers out for you. There are various estimates. The organized sector is just about 28 million, employs 28 million, which is just 6% of the total workforce. The unorganized sector employs 94% by some estimate. These are NSSO estimates. 437 million people are working in the unorganized sector. Their jobs are going like this. Colonies are saying you can't construct houses, labor can't show up, they have to sit at home. These are people who buy enough food just to last a day. How can they sit at home for 3, 4, 5 days? Think about it. There are many other estimates. Casual workers, around 25% of the workforce. Self-employed, 52% of the workforce. A total comes to about 33.6 crores. These people, if you go to the next graphic, these people, 33.6 crore of Indians, a quarter of Indians, can't afford to sit at home. What do we need to do? The Prime Minister today spoke with the captains of Indian industry, some of who are joining us here. Anil Agarwal, founder and chairman of Vedanta, is with us. Dr. Anand Ranganathan stays on. Mohandas Pai, chairman of Global Manipal Education. I want to begin first with you, Anil Agarwal, founder and chairman of Vedanta. I want to ask you, sir, what A, did the Prime Minister tell you, and B, how necessary is a bailout for different sectors of the economy?
No, the things are not clear, but it's very nice. Our Prime Minister is proactive in every respect. I've seen in America, I've seen in England, I've seen in Europe, the way they have been little bit behind. Our Prime Minister was proactive to seal the border, stop the airline, restrict all restriction, and everybody is following by and large. So this is whatever best can be done. At the same time, everybody is concerned. I have most concern. The Prime Minister says essential goods production should continue, and yes, everybody was mentioning that is very important, the liquidity to be maintained. If the liquidity is not maintained, we all will be in trouble. Whether it's America, whether it's England, whether it's Germany, has come forward to maintain the liquidity, roll over the loan, roll over the all CPs and the bond for at least for 6 months, to make sure these show whatever manner we don't deprive people not to take salary and so on. As far as I'm personally, my heart is, as you have been mentioning, I've been listening, that you are the one from the heart, and I'm same page. The people, what we call it in Hindi, dehadi, रोज का dehadi वाले लोग, उनकी जो खोमचे वाले लोग, हमारा मालिश वाला, these people work on the daily basis. They have to be get something. They have to survive. Some sort of, and if they don't survive, they will come to the road.
Yes.
And we have to come out of the some scheme.
I can now tell you,
I've said,
after your conversation with the Prime Minister, Mr. Agarwal, and other captains of Indian industry, some steps have just been announced. The Finance Minister, Nirmala Sitharaman, is offering some relief. States can lift food grain for 3 months on credit from the FCI. So payments don't have to be made in the immediate. This is because then states won't have a cash crunch in the distribution of food to poor. Contractual workers working for Government of India to be paid their full wages. Very important. No deduction in wages for inability to attend work. Very, very important, viewers. So they can actually stay at home. One now only has to identify them and pay them. Step 3, 30-day grace period for payment of life insurance premium. Very, very important. Ease the burden on all policy holders. One would have expected certain deeper cuts, but maybe they're following. I can tell you in Uttar Pradesh, 1,000 rupees per month for daily wage laborers and construction workers will be given. Kerala government says 20,000 crore relief package to overcome economic meltdown. Kejriwal also has called upon landlords to defer payments on rent for months and has announced some very important freebies like giving rice and wheat free to the poorest of the poor. These are very important measures. If you are going to starve, you're not going to stay at home. Dr. Mohandas Pai also joins the panel. Mohandas Pai, what do you think is required to make India stay at home?
Well, Rahul, I think the finance minister has not been fair to the people of this country who are suffering. She's taking good care of government servants who get salaries, whether they work or not, from taxpayers' money and contract labor, which is very good. But what about the rest of the people? I have written an article which says that we need a minimum of 5 lakh crores as stimulus.
Yeah.
The United States is giving a stimulus of $2 trillion, 10% of GDP. The UK, 360 billion pounds, 15% of GDP. We want at least 5 lakh crores, 2.5% of GDP. What is it for? 15 crore families, pay them 2,000 rupees a month by DBT every month for the next 6 months. By paying for 15 crore families, there's about 1,80,000 crores. Then there is tax refund, direct taxes, indirect taxes, GST, and payment to the states, 1 lakh crore. Give people back their own money, so industry will have liquidity. For affected sectors like airlines, hospitality, travel, tour, defer taxes for 6 months. That will be about 50,000 crores. Then ask all the banks to give 10 to 20% increase in working capital for all their clients immediately, like State Bank of India has done. And to make sure the money comes back, create a kitty of 50,000 crore as a credit guarantee fund.
Right.
So that will work. And I think for the medical help and for hospitalization, keep apart 25 to 30,000 crores. Anybody who goes to a hospital can get service without having to pay for it.
Okay,
lastly,
very important.
One more point, Rahul. Lastly, to make sure that the people get care, start a massive hospital building program in 500 districts, where each district will get a 500 bed hospital at the rate of 50 lakh per bed, and that will be something like 1,25,000 crores. We need a very, very large stimulus, and they can borrow money from the bond market.
Well, I don't know how easy that will be if you want to go into lockdown and prevent the transmission, but I think all the other points you've made are very, very important. I'll tell you, it's not unreasonable. 2.5% of GDP, which is 5 lakh crores, could be used as a stimulus. I'll tell you, if crude stays at $25 a barrel, 50 billion fall in India's oil import, a saving of 3.7 lakh crore rupees or 1.5% of GDP. So it's not an astronomical figure that Mohandas Pai is calling out for. Dr. Ranganathan, quickly, final thoughts, sir.
Yeah, I think Dr. Pai is absolutely correct. You know, most of the affected countries are spending or thinking of spending or rationing out 10 to 15% of their GDP. I think we, you know, as usual, we are a little bit behind. We not only have to think laterally, but also collaterally. The collateral damage of the people not affected or not infected with corona is going to be much greater than those who are infected with corona. We must realize this. And I think it's a pity that Rahul Gandhi is not taking at the front line with the Prime Minister. Otherwise, I would say the best short-term solution for this is Nyay. Get in the Nyay scheme. This 5 lakh crores that Dr. Pai is saying is exactly what Nyay would have cost for a year. 5%, 5 lakh crores. I think get Nyay for 1 year. Just